Hi, everyone. Good afternoon. I'm excited to get started today learning about unconscious bias in nursing education. As you know, our presenter is Tiffany Gibson, and she'll introduce herself in just a moment. Um, please stay after this presentation. The presentation is about 22 minutes long. We'll have a live Q&A following this presentation where you can ask questions directly of Tiffany. If you have any questions during the presentation, you can put them into the chat box and we'll go over those. We'll get to as many as we can. And then after that, after the Q&A, as you sign out, a survey will pop up, and please fill that out. We want to be able to bring you more presentations that matter, so we can do that if you answer the few questions that we have for you. Thank you all for showing up today, and give me just one moment and we will get started.
Hello, and welcome to the conscious conversation of unconscious bias. In today's session, we're going to go over the definition of implicit bias, also known as unconscious bias, and the benefits of training on recognizing your implicit bias. We're going to talk about the correlation between implicit bias and cultural sensitivity, specifically in the classroom and in curriculum. And we're going to talk about strategies that you can apply that can be used to minimize the impact of implicit bias on students and the curriculum. I'm Tiffany Gibson. I like to call myself a nursing agitator, a professional troublemaker, out here in the world making good trouble, creating new conversations, coming up with new methodologies to create the new nurse mindset. I have experience as an adjunct faculty member. I'm a clinical nurse educator, certified in professional development. I do consulting work with healthcare organizations, facilitate courageous conversations, and implement inclusive interventions in safe environments for the healthcare worker. I'm also a diversity, equity, and inclusion advocate. And today we're going to go over implicit bias, what it is, what it means, and how you can mitigate risk of causing harm due to implicit bias. But first, let's start at the top with terms and definitions. So implicit bias is a learned assumption, belief, or attitude that exists in the subconscious. Everyone has bias. It's pervasive. It's something that is either taught to you at a young age or things that you've picked up socially or culturally that has become a norm. It could be things that you've experienced for yourself or things that you've heard about and have made assumptions about that, but not even consciously. Again, it's implicit, it's unconscious, you don't know it's there. Implicit bias can be used to make associations, to make generalizations, and it can be used for safety reasons. And the purpose of the bias is to quickly come to decisions. It's a speedy way to calculate exactly what it is your next steps are going to be. And that can be useful in survival. It's for you acting on your instinct and having a reaction to something immediately. And again, it's for quick decision making. So if I saw a pit bull running down the street towards me, because of the societal connotation of what pit bulls are, vicious dogs, according to the world, my immediate thought, my bias, my unconscious self is going to say, run. But that dog really could be the most friendly pet on the block. But because of how society deemed this dog, what I've heard about this dog, images that I've seen about this dog, I immediately jumped to the conclusion that this is an unsafe situation. And because of my implicit bias, I make the immediate unconscious decision to run. Not necessarily a bad thing, but when we use implicit bias to make general assumptions about groups of people, thereby changing the way we behave and interact with those people, that's when we get into trouble. So let's talk about nursing education, curriculum, the classroom, and our students. When we know that everyone has bias, everyone does, it's pervasive. And we know that we can have societal, generational, cultural beliefs, attitudes, and feelings about certain things and or certain people, we need to ask ourselves, how does implicit bias show up when we are teaching a class? Who writes the curriculum? Humans do. And in that situation, we need to be mindful that there could be implicit bias in our teaching and lesson plans. So here are some things that I would like for you to consider. Review your teaching materials, your mindset, loaded words and phrases, misleading research studies, and or omission of information to see whether or not these things are occurring because of an unconscious judgment or an implicit bias. I want you to think about the stereotypes that you have and any hidden messages that could be conveyed as prejudice and or limited beliefs in relation to nursing education and content. Reflect on your own biases and stereotypes. We all have them. And check your teaching materials to make sure that they're inclusive. I also want you to role model and to teach your students how to recognize stereotype and bias. And I understand that these are not all things that are instinctual. These are definitely things that you as an educator would need to be taught, then practice, then master so that you can role model to your students, but it's not at all impossible. So implicit bias training is extremely important in general because it helps a person make aware that they do have unconscious bias, it exists, but then in the training, they also get steps on how to reduce the likelihood that these biases will impact decision-making and or behavior. But specifically for us, for nursing educators, implicit bias training allows us to ensure that cultural sensitivity is there to predict academic success for our students, and that we're not automatically making assumptions due to cultural factors that are inconsequential on our students. For example, if a student is a Black woman, a single mom, low income, has lots of responsibilities at home, may not necessarily be the most emotionally intelligent or mature, trying to get into nursing as a way to level up herself to make better for her family with increased education, which thereby will give her increased salary, which thereby will help her family and her lifestyle. But she also wants to be a nurse. But due to competing priorities with home life, it's affecting her academic life. And it's not that she doesn't want to show up for class, or it's not that she's being lazy, or it's not that she's not putting in the effort. She doesn't have the support needed at home to make her an efficient and effective student. She's probably a first generation college student, and there isn't anyone that can help her with study strategies, learning strategies, test taking skills. And we also know that anxiety and stress trumps cognition. If I have lots going on at home, if my home life is unstable, that is going to spill into my professional and academic life. So when this woman maybe fails a test, or it's late to clinical, or maybe her clothes aren't ironed out all the way, it's not that she isn't trying or that she isn't putting in the effort. It's really, this is the best that she can do right now. And sometimes our academic policies are so strict that it is gatekeeping those who are in that situation to proceed and excel and move on. And we need to think about that. Sometimes in nursing school settings, our policy does not reflect what the workforce looks like, and it actually gatekeeps and hinders people of color who do not have the privilege to get the support that they need in order for them to advance. And so with implicit bias training, you'll be able to pick up on cultural sensitivity, predictability more often, to check in with yourself and check in with your institution to see, are we putting things in place unconsciously, that's actually a barrier for our students to succeed. The other thing about implicit bias is when our students feel that they are being negatively judged or stereotyped, it's going to automatically undermine their performance, and unconsciously they're going to underperform, regardless of their socioeconomic standards. If emotionally I do not feel valued, if emotionally I do not feel supported, and I already have these insecurities within myself, then the person that I go to for my academic success is validating these things for me. And so why try? Why bother? Because the confirmation bias that I get from the negative stereotype leads me to believe that all the negative things about me are true. And so, as educators, we want to make sure that we are giving micro affirmations to our students to let them know that we see them, we hear them, we value them, and we want them to win. So, we want to prioritize implicit bias training. One, to ensure positive and constructive support for our diverse students, because they do need separate support. And that is the difference between equality and equity. Equality is everyone gets the same thing at the same time, but equity understands that that may not always be fair and just, because some people need additional accommodations just to even get to the baseline of performance. We also want to prioritize implicit bias training to recognize cultural sensitivity as a foundation for cultural responsiveness in our pedagogy. And then thirdly, we want to advance culturally responsive teaching methods that mitigate unfavorable biases and improve student outcomes. So what does that look like? Here are 4 quick steps for you to put some strategies into place as soon as you finish this webinar to get you on the right track to be self-aware of implicit bias within yourself and within your institution. 1, required implicit bias training for all faculty and all staff, and ongoing diversity, equity, and inclusion education. DEI is not a checklist that happens once a year with your mandatories for regulatory purposes. It's supposed to be a part of your culture with constant check-ins and evaluations to see, are we equitable and are we inclusive as peers, as faculty, as staff, in our curriculum, and is what we're doing in alignment with our institution's policy. 2, you want to provide psychological safety for students and staff members. Again, if I do not feel valued, wanted, seen, and heard, I'm not going to speak up. I'm not going to ask for help. I'm not going to tell you something is wrong. And then the assumption is that I don't want to be here and I'm not trying hard enough. But in actuality, I don't feel safe to say that I need the help. We also want to think about the stereotypes of Black Americans or any other person of color about needing to do twice as much, to work twice as hard, just to get a little bit piece of the pie as the majority. And so that psychological safety is really important. You want to also engage in data walks with your peers to collect evidence of culturally responsive pedagogy and share exemplars with the staff to see what else is happening in the other departments and the other classes with other curriculum, and how can we integrate some of these stories and or evaluate and remediate what we have going on. And number 4, recognize decision points that are vulnerable to implicit bias and when implicit biases are more likely to be activated. As a clinical instructor, I've had to catch myself multiple times when a student was either late to class or showed up disheveled or on the clinical unit seemed to be mentally distracted, and not automatically jump to the conclusions that they didn't prepare or that they didn't want to be there, but to emotionally check in with them first to make sure that what they had going on at home wasn't a factor. Once we can eliminate that out the way, then I can focus on the business at hand. Our students are more than just numbers, they're humans. And we want to lead with human kindness right? And dignity and humanity before just jumping right into the business and being clinical all the time. With implicit bias education, we know that it's never going to be completely removed from everything that we do. Again, everyone has implicit bias, and because it's unconscious, we sometimes may not even know that it's there. But we definitely can take steps to counteract these stereotypes and increase equity. And as educators dedicated to the growth and expansion and competency of our students, we can empower them to think critically, to analyze content, and to practice inclusive perspective taking. We can also check in with ourselves to make sure things that we say are not microaggressions. For example, asking a student about their hair every day, all the time, may be a microaggression to the student who may have their hair in a certain style for protective reasons. We know that the Crown Act in the United States have been passed in some states, but we also know that in some states, Black women or women of color who have specifically textured hair or just wearing their hair the way it naturally grows out of their head is being scrutinized and penalized because it doesn't look professional. But who came up with the definition of profession anyway? And is using the term professional a way to gatekeep who gets into certain places just based off their looks? This is why implicit bias training is so important. And so here are some strategies to overcome the bias. One, we want to make sure that we are ending generalizations. One of the things that I guess grinds my gears as an educator is when we talk about cardiovascular health and we talk about African Americans or Black people, and you go through the risk factors, and one of the risk factors is being Black puts you at higher risk for high blood pressure. That's not true. The color of my skin, my complexion, my melanin, the amount of pigment that I have does not increase my blood pressure. However, the fact that I am Black, the fact that I am a woman, the fact that my living conditions are subpar, the fact that I may live in a certain community where I don't have access to fresh fruit, fresh water, my reading level, my financial level, my home environment, the air pollution, things of that nature raises my cortisol and keeps it up. And I am at a constant level of stress. It is chronic. That increases my probability of having hypertension. And because I don't have access to healthcare, and because I may not be able to afford my meds or get to all of my appointments, I do not have the ability to treat myself all the time. And so I may not show up for appointments. I may not take my medicine. I may have to decide this month, am I paying the copay for my hypertension meds or am I paying my light bill? And then what happens in nursing when I finally do come to an appointment? I'm called non-compliant. Instead of not adherent, which is a completely different thing, but it is the lifestyle that I am in that makes me at a high probability for hypertension and not the amount of pigment in my skin. So it's not enough to just leave it at that for our students and talk about social and talk about health disparities, but we need to talk about the socioeconomic health equity or inequities that lead to the health disparities, that lead to certain races and ethnicity to have certain morbidities. Now, granted, there may be some genetic factors in place, but that's not true all the time. And so we want to make sure that when we are talking about certain people, certain ethnic groups, certain races, that we're also digging deeper and not making generalizations. We also want to overcome bias with micro affirmations to let your students know that you see them, that you hear them, that you understand that things may be challenging for them, and that you are supporting them. We want to make sure that when we say we have an open door policy, we really do have an open door policy, and that your students who may be neurodivergent or may have other type of differences as far as mobility, as far as academic setbacks, as far as finances, that as educators, we're not just brushing that off, but helping them to connect with the resources that they need in order to succeed. So we want to provide alternatives to stereotypes by allowing time for reflection. We want to provide exposure to different experiences and materials in teaching. We want to model metacognitive processing, using examples to illustrate your thinking and discuss if an initial inclusion is fair and equitable or if it was based on incorrect information. We want to paraphrase out loud what we think we heard the other person say, and to make sure that we check our understanding, to make sure that it's not stereotype that I'm hearing, and that is not what is interfering with my mental processing. And lastly, builds perspective. Ask your students to critically think through something, practice mindfulness together, and use stories told from their perspective in your lectures and a part of your curriculum. One of the things that I've noticed in being a DEI specialist is sometimes I hear a lot of nurses and faculty members say, well, it can't be that bad, or that's not true, or maybe it's not as significant or prevalent as you say, Tiff, because it hasn't happened to them or because they haven't seen it. But just because something is not your lived experience does not mean that it's not true. So allowing students to join in on the conversation during a lecture allows them to share things from their point of view and their lens, which would decrease your bias. So to sum this all up, implicit bias is not inherently bad. We know that it's there to keep us safe in some situations. However, we want to be mindful about how it's used to influence behavior. We want to make the connection between implicit bias and cultural sensitivity so that we know that in making that connection, it can decrease negative stereotypes about our students. And lastly, implicit bias training is required. You want to have it as frequent and as often as possible for inter and intra personal check-ins, because that will be a great way to mitigate bias in the classroom. And the more we role model this behavior for our students, the more they're going to pick this up and be equitable and inclusive nurses once they get into the profession. To learn more about implicit bias training or to start implicit bias training in your institution, please contact me on LinkedIn, on my email, or at my website. And you can also follow up with Unbound Medicine. Have a great day. I hope you learned something new that was insightful and got you to thinking. Continue to practice with a curious mind, and see you next time.
Tiff, are you there?
I am here and I'm looking at the comments and I'm so excited and I'm so thrilled. And thank you everybody for your feedback. I do want to make mention, someone said that they liked my professional troublemaker moniker, which is something that I've adopted from author Lovey Ajayi Jones. I just want to put that out there for the record because that moniker is trademarked. She has a book called The Professional Troublemaker. It is highly recommended. And so that's where I got it from. I am here to stir the pot in nursing on purpose because there's a lot of things that we need to just be aware of that no longer serves us, that we need to change so that we can move forward and change the culture of nursing. I know, Hillary, you have some questions for me. I also have some questions and some things that I want to bring up myself, but now is the time to ask all your questions and to put them in the chat box. I am so open to hear your feedback and your thoughts, and to have this be the engaging part of the session.
This is really, I'm so taken with, first of all, Tiffany, I was really looking forward to this particular presentation. When I reviewed it earlier, I I think I'm really good, right? I think that I take a beat. I really try to check my bias, but even some of the things that you mentioned in this video just gave me a new way to consider the fact that I can't remember the particular issue, but the fact that it isn't Black people who suffer more.
Hypertension. Yeah.
Right.
High blood
It's
pressure.
not the
Mhm.
color of your skin, right? We need to look deeper at those
Yeah.
issues and
Yeah.
ask what the really underlying causes are. And the only other thing I want to say is that I love that you provide this information to nurse educators who teach nursing students, who go onto the floor and then apply it to their patients.
Literally a direct line of transformation. It's a direct line of transformation. Students don't know what they don't know.
Right.
And people don't know that they have implicit bias. That's what makes it unconscious. That's what makes it implicit. But if we can say, as nurse educators, this is a situation where your implicit bias may show up. And so here's where you may want to kind of stop, pause, and do a self-assessment. What it does is reinforces to the student that when I'm on the clinical floor or when I'm even with my coworkers, because sometimes we don't even know how we treat and talk to ourselves. A lot of the things that we do as educators is always front facing. Here's how you teach your patient. Here's how you do active listening with your patient. Here's how you do empathetic listening, conflict resolution. It's all patient facing. But right now, what we're seeing in nursing is that a lot of incivility is happening amongst our peers or in the classroom, and we don't even realize it until something comes up that's so egregious that we need to talk about it. And so with starting with the people who are doing the teaching, and having them get the strategies, then they role model the strategies, and then they help the student reinforce the strategies, it becomes a part of the student's culture. It becomes a part of their practice. So now when I'm on the unit, I know what this looks like and I know how to speak up against it because I've been prepared.
Yeah.
Mhm.
Wonderful.
Yeah.
I just want to see, I don't want to miss any of the questions, and I think we have a few.
Yeah.
We're currently working on this at our college, and we have a goal to have all faculty receive implicit bias training by the end of the year. What is the best way to go about this?
Oh, first of all, that's great. That is so good. Here's something that I want you to be mindful of, though. Let's not make training a mandatory thing where it becomes a part of your checklist, where it's like, okay, we did implicit bias training, and then you tuck it away until the next fiscal year, and then you bring it back out again. What you want to do is incorporate it into your practice, into your culture. And so, yes, we did the training. Great. Now, how do we use the information from this training and actually integrate it and use it and infuse it into what we're doing? And so taking what you've learned, maybe breaking it down by culture, by quarter, having a committee that can keep you on task and accountable, and then literally making the changes to accompany what you've just learned to make sure that you're using the information that you was taught. And so that is a great way to incorporate training. One of the things about training, especially in nursing, because we have to renew our license, we have mandatory requirements that we have to do in continuing ed, it becomes mundane, right? It becomes something we have to do. It's the end of your RN license cycle. We have to get 30 CEUs before you have to do it. Or it's the end of the fiscal year or the calendar year. You have to get this in. Make sure you do your modules. That's not what DEI is supposed to be about. It's not just modules, right? It's culture, and culture is lifestyle. And so how do you put that into your lifestyle?
Excellent. Thank
Mhm.
you.
You're welcome.
Making changes are challenging, as some don't feel they need to change. How to
Mhm.
elicit support?
Yeah, so change management is a whole conversation within itself. And maybe that's something that we can do, Heather. We can airbook that to talk about change management, because yes, while we want diversity, equity, and inclusion education to be a part of the culture, that does include changing mindset and changing practices, but then change management within itself is a whole nother topic. And so first and foremost, I would say find your stakeholders who are excited about this work, because the excitement is going to create a buzz, is going to create awareness, is going to create participation. Once people see that, and then you're going to have people who are on the fence, they're going to be a little bit more leaning to your side of things. And that's how you get more people onto your team. And there's always three parts of a team. You have your go-getters who they're for the change, those who are on the fence, who are like, I'm not quite sure. Let me see what you do first before I make a decision. And then those who are so allergic to change. I'm not changing anything. I don't want to do it. And so you always want to spend your energy with those who are for it and those who are on the fence, because that's how you get the majority. Once you have the majority down, then you can start making some real impact. And then those who don't want to change will have to fall in line anyway, because everybody around them is doing the thing that they don't want to do.
I love it. That's perfect for every organization. Do you have any I think this is a great question. Do you have any recommendations for those of us who teach online, read discussion boards / written assignments to increase their attention on microaggressions / implicit bias?
Yeah, absolutely. I think regardless if you're in person or if you're online, it's all the same to me. And so a couple of things as far as like when you're reading discussion board questions, right? You want to always ask yourself, if you feel polarized against something, where is this coming from, right? Because as we know, implicit bias doesn't mean that inclusivity is not one of your values. It doesn't mean that you are inherently racist or anything like that. It has nothing to do with that. However, implicit bias unchecked can lead to stereotyping, and it can lead to people not feeling heard or not being seen. And so there's a couple of questions that I actually have for those who are interested. If you have your pen and paper, this is also being recorded, and so you'll have access to this. But here are 4 questions that you can ask yourself to do a self-check in the midst of going through a situation. 1, am I looking at the issue from a perspective of the most vulnerable? Right? Am I looking at the issue from the perspective of the most vulnerable? A lot of times, because we are the authority in the room, as the educator, as the expert, as the one with the most education and experience in nursing, a lot of times because our ego says we know what we're doing, we have the right answer, we got it. But we're not taking the time to step back to look at how this could be affecting the other person, or this person's life experience is valid to them. And so while I may not have experienced that, it doesn't mean that it's not true. And so am I looking at the issue from the perspective of the most vulnerable? The second is, am I listening to understands or immediately responds, which we know that coming from an active listening and empathetic listening world, that is something that we teach. We have whole sections and lesson plans on communication, but do we do this ourselves as the educator? Right? So am I listening to understand, or am I listening to respond? The second is, am I growing in awareness and knowledge of how I can do the best good, the good on a daily basis? What am I doing in my professional and personal practice to increase my awareness and my knowledge of things outside of my box? Implicit bias does not show up to us when we continue to be and work and play and talk to people who are in our box. Because if everyone looks and sounds and thinks like us, then there is no bias, right? Because everybody has the same perspective. And so what am I doing on a daily basis to grow in my awareness? And then lastly, am I open to the feedback? Am I open to feedback? Am I a perpetual learner? If someone tells me that they were offended that I asked them about X, either the clothes that they wear or the food that they eat or their hairstyle, and they tell me that they are offended, I need to be open to that and not immediately say, well, I wasn't trying to offend you. I just wanted to know. Yes, intent versus impact. And so while you just wanted to know, which is great, maybe how you asked, the way you asked, the tone, where you asked, it can be translated to the other person as something that can be offended to them, right? Especially if the person is feeling judged. So something really easy. We are currently in the season of Ramadan right now, which is not a commonly celebrated religious holiday in America compared to Passover or for Christians, Good Friday and Easter, right? And so for those who are participating in the fast, right, during the daytime, they're not eating, and at sundown, they start to eat. And depending on their culture, they may break their fast with certain foods. And those certain foods may not be common to the typical American. So being inquisitive about someone's food choices that can come off as intrusive can be very offensive to that person on the other side. Whereas I just want to know what you're eating. A date? I've never seen a date. Where do I buy dates from? Like it's a Mediterranean thing. Where did you get it? But to the other person, it can feel like I have to almost justify why I'm eating this. I'm a Jamaican, right? My parents are Jamaican. I grew up very entrenched in the Jamaican culture, and I eat a lot of traditional Jamaican foods like curry goat. Love it. I never forget one time bringing that for lunch one time at the hospital, and the smell is very spicy and aromatic, and people, oh my God, you're eating goat? And it's like, oh, all right, well, now I don't want my food anymore. Like, now I don't want to eat in front of you anymore. And this is something that I enjoy. But even just you saying that, just makes me say, oh, okay, forget it. I can't bring what I would eat on the regular. If that was my last meal on earth, I would eat it. If that was the only meal in the entire universe, I would eat it. But now I feel like I can't enjoy myself because of the little microaggressions. So just something to be mindful of, whether you're online or off.
I love those 4 questions, by the way.
Thank you.
I think I'm going to dwell on those later. I like this. I went to my first nurse lead cultural diversity training 40 years ago, which is impressive.
Yes.
And I see so little change. Nursing should be beyond awareness. What have you found can motivate faculty forward? Is it confrontation? How does a school bring you on board for training and ongoing monitoring for change?
Yeah, so 40 years ago, kudos for you for still being active in nursing. If you've already participated in something 40 years ago, that's one. Two, what do we do in regards to going from awareness to activity, right? Like, how do we go from inspiration to implementation? That comes with putting strategic goals in place. That's what that is. It's almost like having motivation versus discipline. I'm motivated to do something. I go to the conference and I have my book and I write everything that I learned from the conference in the book. I come back, I tell everybody how great the conference was, and that little book just sits on my desk. I never open it again. But everything, I loved it. I completely loved it. It was so inspired by it, but then nothing else happens. Why? Because I did not create SMART goals around the information that I received. And so when you, again, going back to any type of DEI training that you have, you now have this new information. We just sat here for 45 minutes and you got new information. And now what do you do with this? Once this is over, now what? Right? So my first step would be, once the recording goes out to everybody and you replay it, you can look at some of the quick win strategies that I included in this PowerPoint and literally put that on a timeline. Do you have a DEI group that can help facilitate this timeline? So there were 4 quick win strategies. You can either spread it out every other month. You can do 1 per quarter. As we're wrapping up this school year and you're planning for a fall for the next school year, do you want to do that out per semester? You have the time to kind of sit on this, but you also need a group of people because DEI work cannot be done alone. So you need a group of people to help with the facilitation and the accountability. Where I may come in is as a subject matter expert and the consultant to help you put the timeline in place, to tell you what goes where, what that looks like, to give additional training support and resources. And again, you can contact me using my email, hello@newnurse-academy.com, or LinkedIn at Tiffany E. Gibson to put that in place. But I've had a couple of nursing schools reach out to me, and that's the work that I do, where I look at their curriculum or I help them create a DEI committee because they don't have one, or help them to revamp something that they had that no longer works, and give them new strategies on how to move forward.
Excellent. Do you have time for
I do.
more? Excellent.
I
Thank
do.
you. I'm enjoying this so much, as always. We've heard through our College of Nursing Satisfaction Survey that we do not do well with how we speak with our African-American students. For example, one faculty member was speaking with a student and the student got upset and faculty member said, "You seem angry." They immediately became
Mm,
upset and stated they were using a stereotype. How should we have handled this?
yeah, that's a good one,
Mhm.
especially because this person is African American on the receiving end, and so that stereotype of the angry Black woman pops up. And so, why am I angry? Why am I not passionate? Why is it anger? Which technically anger is a derivative of passion, right? It is. It's on the other side of the spectrum of love, but it's still passion. Um, so here's the thing: instead of saying you seem angry, which is an assumption, it's you use objectives. So you're raising your voice at the time, you're slamming the door, your body language is telling me X, Y, and Z. So I'm using facts, right, which don't lie. Can you tell me what it is that you're feeling? Now let the other person tell you how they feel instead of you telling them you seem to be. Because maybe I'm not angry. Maybe this is frustration, which is
Yeah.
not anger. Maybe this is disappointment. Maybe this is irritation. And it's coming across in this way because I don't feel heard, and or this is how I've been displaying this emotion my entire life. I don't know how to do anything else.
Yeah.
Right. So this is also a cultural representation of how I express myself. But on the other end, it's you seem angry, which is a trigger word for Black women in the professional workplace. And so another way to say that is right now, there's lots of emotions going on right now. Can you tell me what it is that you're feeling? That way you're not even assuming anything.
I love that. That's perfect.
Mhm.
And again, can be used in so many, not just when addressing a person of color, but like
Any
in
situation.
any situation.
I
In
see
I'm
this come
thinking,
up a lot. I see this come up a lot in the LGBTQIA community too, where
really,
people still don't understand the difference between gender expression and sexual identity and sexual preference. Three different things, three completely different
yeah,
things. And so while I may present one way, but I identify as something else, and who I love, it could be something else, are three completely different things. But the person on the other end says, but you're dressed like a woman,
yeah,
but you were a man, but you're dating another man. So doesn't that make you just gay? Like, no, you can't tell me what that makes me.
yeah.
Only I can do that. And so instead of labeling the person, you ask them, what do you feel? What are these emotions that you're experiencing? What do you want to be called? Even saying Black versus African American,
Yeah.
that right there can be
Okay, that right
conversation.
there. What if you have not had time to ask somebody what their preference is?
So I guess the politically correct way would just say both
Both.
African American and or Black,
Okay.
right? But if you can ask the person what's your
Yeah.
preference, for me it's Black because my heritage is Jamaican. I don't
Right.
relate to African American. I don't.
Yeah.
I'm a Jamaican American.
Right.
It's different. Some people say instead of African American, they say American African, because an African American should be someone who's literally from the continent,
Right.
who can trace their roots to a country, who came to this country, like a German American,
Right.
right?
Yeah.
Like a Irish American,
Yeah.
right? But because of the societal history of America, we just use that. We use that as your geographical location as your race.
I was also, what I was thinking before with regard to the anger, first of all, as an East Coaster who lived in the Midwest for a while, I see how passion can be misconstrued as something else
Yeah.
sometimes. But
Yeah.
I was also thinking just in asking questions, I was thinking more even in talking to not only adults, but children, just taking that beat and saying, what is it you're feeling?
Yes.
Overall is just a
Yes.
great way to approach
It
those situations.
is. And you know how I feel about emotional intelligence, right?
Yes.
So that's literally what this all falls under,
Yeah.
the emotional intelligence umbrella. And I got into emotional intelligence in the clinical nursing education sector, teaching nurses how to respond to violent patients in the hospital. right? And so how you can non-violently respond to someone who's violent towards you. So it was a lot of like crisis intervention training for violent patients in the hospital. But then as I got my certification in that, I realized this is going to make me a better parent. Like this everything I'm learning here about warning signs and anxiety and triggers and questions and my tone and my approach and how I can spark someone's behavior. I'm like, oh, I'm going to use this on my 7-year-old.
It's universal. It really is.
Yes.
Do you have time for maybe one or two more?
I have all the time.
Okay.
I have all the time.
I want to be respectful of our participants' time as well.
Yes.
Let's see. We have heard through our college. Nope, that one we just did. Let's see. And how do we break through the bias stigma that we have experienced for 44 years?
We decide that we want to change. So in order for you to do anything, you have to first make a decision. Right. And so I call myself an agitator in a professional troublemaker on purpose. I'm not going to wait for somebody else to spark the change. I am making the decision that I am going to be the ripple in this water. And I am going to be the change that I wish to see.
Yeah.
Do we need to wait for textbooks to make a change? No. What we can do as nursing educators is that the textbook says this, but here's what I want you to be mindful of. Here's where I think this can improve. Here's where I think you can take this and open it and expand it something different. That's a great teaching moment. So you first decide that, okay, from here on out, now that I know better, I'm going to do better. And so I'm going to take this information and I'm going to integrate it into my lesson plans. I'm going to take this information and I'm going to share what I learned today with my students and my other colleagues. I'm going to go back to my admin and say, this is what we need to do. Like, who was on our DEI committee? How can I join the DEI committee? Other than food, flags, and fun, what is the DEI committee doing? Because it shouldn't just be celebrating certain months because it's certain months on the calendar.
That's right.
What does that actually mean to us? And how does this align with our values as an institution?
Yeah.
And so that you literally just have to make the decision to just say, I'm a change agent and this is what I'm going to do.
My sense too is that textbooks are taking a long time to catch up. I think you just addressed that. One example that comes to mind has to do with integrating non-binary gender issues into our pediatric classes. Do you have anything to say or add to this topic? Also, they just want to say thank you and they really
You're welcome. You're welcome. You're welcome. All right. So can you repeat the second part of that question again? Okay.
Textbooks are taking a long time to catch up. One example that comes to mind has to do with integrating non-binary gender issues into our pediatric classes. Do you have anything to say or add to that topic?
Yeah. So instead of waiting for the textbooks to come out, which I know new editions come out all the time, but that doesn't necessarily mean that the content inside the new edition has changed. It's to literally go to websites that are doing this education in the moment and pulling from them as your source. So there's lots of evidence-based and peer-reviewed journals and articles and research from organizations that's currently doing the work. And so you'll pull that in as a supplement to your textbook. So instead of waiting for the publisher to make that change, you yourself will go out to see where you can get that information from, or contact a consultant or an advisor or someone that's currently an expert in the field to see if they already have some places for you to go to look at in certain websites. So as it relates to non-binary gender issues in pediatric cases, specifically for the age group of students, I wouldn't even say age group. I would say non-traditional and traditional students currently right now, social media is all the rage, right? Everyone is getting their information firsthand, not secondhand, from the internet. So are there particular cases that's happening in current events that you can bring into the classroom, and then the case itself is reviewed on how non-binary gender issues may pop up? One of the things that for me that came up with was in the maternity ward, labor and delivery, everyone is labeled mom and dad, everyone, right? Everyone is mom and dad. First of all, you don't call people by their names. It's mom, hi dad. The sleeping chair beside the bed is the dad chair, right? on the actual paperwork, if there's a place for mom and there's a place for dad, well, what if there's two moms? What if there's two dads? What if I don't want to be called mom? What if I'm a surrogate? What if I'm having my baby for my gay friends? Like what I'm not mom, right? And just because there's two moms, they may not want to be called mom. They may want to be called something else. So just leaving things, or breastfeeding, that was the other thing too that came up. Now is chest feeding, because we're seeing that there are a lot of men who transformed into women. No, women who has who are now transgender men who still have all of their reproductive parts, right? So going back to what I said before, I express myself one way, but how I identify is something else, and who I love is something else. So I could be Timothy to you, but still have all of Tiffany's biological parts. Mm-hmm. So I'm able to have a child naturally and breastfeed my child, but I don't call these organs my breast, they're my chest. Right. Very confusing. Yes. One, it's not for us to understand, right? Because that's the other thing too. I don't understand. It's not for you to understand. Right. Just respect it and move on, right? It's not for you to understand. Respect it, move on. And then two, what do you need in this moment for me to help you be successful? That's literally it. What do you need in this moment for me to help you be respectful? I don't need to understand your entire, well, if you did this and why this and what do you need in this moment for me to help you be respectful? And so those are the scenarios that I would bring to my clinical groups for discussion. Because when the students come into the unit, the nurses are unconsciously using terms mom and dad, as if every single family structure has a biological female who identify as female and a biological male who identify as male, and uses this language mom and dad.
That is absolutely perfect. And I think that is probably a good place to end. I really appreciate that question. I can't see who asked that question, but thank you so much.
Yeah, there is a question in the Q&A box. Did you see that one?
Is there one that I'm not seeing? What are you looking at?
It was suggested in a previous workshop I attended to go through PowerPoints for lectures to review the pictures for bias, such as every time a family is mentioned, the pictures are of a husband, wife, and children versus same-sex parents, mixed race couples, etc. Any other suggestions for reviewing our teaching materials or lectures? That is like the ultimate question right there. Yeah. Because that is a quick win situation that educators can do immediately. So you would want to also look at pronouns. When you are referring to nurses, naturally we say she, her. When we're referring to physicians, we naturally say him, his. We can automatically change that right now. The nurse is not always she, her. The physician is not always him, his. We know that nurses can be men. We know that physicians and surgeons can be women. So that's one. Going through and looking at your pictures to make sure that they are representative of the population that you're teaching and the population that the students are going to be looking at. And so I don't know if people realize within the past 12 months, there's been lots of images of medical descriptions of Black and brown bodies, because everything in the textbook is of a white patient, everything, right? So when you look at the visual arts, even if it's cartoons or if it's a cadaver or if it's whatever, if it's illustrated, it's all of a white person. And so on social media, there's been lots of new images of just Black and brown bodies. I'm currently pregnant right now, and I'm using an app to track my pregnancy. And one of the things that I loved about this app was changing my avatar's complexion. But when I was pregnant 7 years ago, I didn't have that option. So the avatar that will pop up was of a white woman. I'm like, that's not me. But now I can change my avatar to my complexion and my body type, right? Because what I look pregnant now and how I look pregnant then is two different things. And I want something that's going to be relatable to me, that I see myself in. And so little things like that and tweaking things, images and words go a long way.
So, and somebody just asked if you have a source, do you have a suggestion for where they can find alternative images?
So I always start with Google, and then from Google, just see if the source from the Google image is something that's reputable. I don't have one particular website, and the images that I've seen have all been shared on social media. And so I will always start on Google and then see if what Google presents to me is from a reputable source.
And I also guess the same could be true for looking over case studies, right? And seeing.
Oh, yes, I have. I laugh because I roll my eyes every time I do a case study. I recently did a case study with my mentorship group about it was about a nurse who gave the wrong medication in relation to what's currently happening in current events.
Okay.
And the nurse was a labor and delivery nurse, but her patient was a 60-year-old patient who has a gang member boyfriend, and the gang member boyfriend was at the hospital with his gang friends. How was that relevant to the nurse giving the wrong med? It had nothing to do with the nurse giving the wrong med at all. It had nothing to do with that. And I'm like, why did they paint this picture of this underage pregnant patient and her gang banger boyfriend was the term that they used?
Wow.
So little things like that. So I laugh because now I'm spending my time with my mentees talking about the bias in the clinical review instead of talking about like the actual case in the clinical review. Yes.
Okay. I am going to be mindful of everybody's time. It's almost 4 o'clock.
Yes.
If I do see any questions, outstanding questions, I may shoot them over to you, Tiffany.
Yes.
And I do want to let everybody know to watch out. In a couple of months, we will do another webinar. And of course, I don't have the name of that in front of me.
I don't have it either, but if I'm not mistaken, it's the cultural competency one.
I think you're right. And it will be with Tiffany. We will look forward to seeing you then. If somebody has a question about CEUs, we're looking into that. Might be a possibility in the future. So hang on and keep joining us, and we'll let you know about that. And Tiffany, honestly, I mean, I hope you know I'm sincere. I'm not just saying this because it's my job. I so look forward to this. I love learning from you and speaking with you, and I really appreciate what you do.
Yes, thank you, thank you, thank you. I appreciate this. Clearly, I'm passionate about this. I can do this all day. I love talking about this. For people who are interested in more, and I see some people asking about CEUs, that is something that I can offer through my consulting. We're currently working with Unbound Medicine right now to create something in the future, maybe. So hang tight, please hang tight. We're working it out. But I am so open to going on the road or virtually, because I do have a little one coming. So I am open to presenting this similar topic or doing train the trainers with nursing schools and faculty, so that you can start incorporating this into your culture and not just a checklist. And so thank you so much. I'm going to put my email in the chat so that you all have it. And then you can also follow up with Unbound for my contacts.
Yep.
This is also going to come out in a replay in a couple of days, correct?
Yes.
So all of that information
we'll send an email to everybody who attended and those who had to hop off or could not attend today.
Mm-hmm. So hold on. I sent it to host and panelists. I just want to send this one more time before we end.
So do it. Yep. Tiffany's just adding her email in here for anybody who is hanging on. There it is.
Yes.
All right. Thank you so much again. I'll talk to you very soon. And again, please watch out for messages about our next upcoming webinar with Tiffany.
Absolutely. Have a great day, everyone. Take care. Looking forward to hearing from you soon.
Bye.
Bye.